Okay, well, we're here to welcome you to our webinar today, which is about viral pandemics and how you can prepare. And I am Sangeeta Patty.
I'm Dr. John Apsley. It's a real pleasure to be here.
Thank you so much for joining us on this Saturday. So we're trying to share our screen here. And this is perfect. So the title of this is In the Face of the Viral Pandemics That We're Facing Right Now, how do we prepare, protect, and build immunity? I'm Dr. Sangeeta Patty, and I've been trained at the University of Maryland and also at Georgetown University, where I trained as an OBGYN, and I'm board certified as an obstetrician gynecologist. I also had a chance to intern at NIH in the lab of immunology, interestingly, at the National Cancer Institute for many years as a student, and then worked on the Safe Motherhood Project around the world, where I got some kind of experience about public health. About 15 years ago, I ended up realizing that the pharmacy and the surgery were too really limited of a toolbox to allow me to practice in the way that I want to practice. So I started to practice regenerative restorative medicine about 15 years ago, where the idea was to really turn on the body's self-healing mechanisms so that the body can regenerate. And we developed the 5-point model system, which you'll be hearing about today, which is what we're using to really optimize the human body, including optimizing the immune system so that your body can literally heal itself. The regimens that we'll be sharing do require direct physician supervision, especially for those under the age of 5 who are pregnant or nursing, who are allergic to silver, anybody who's autoimmune, or on blood thinners or chemotherapy. We'll be covering some knowledge about the coronavirus, effective mechanisms to reduce viral exposures, and a basic immune protocol with the science for a daily routine, which includes, importantly, the science of highly bioactive silver nanoclusters, also known as food-grade AGNPs, and the reduction of the viral load. We'll also be covering an advanced immune protocol today that has advanced dosing for reduction of viral load, and also how to prevent a cytokine storm. So happy that all of you are here today to join us. In April and May, you can expect that we'll be coming out with some other webinars, so you can stay tuned for those. I want to start with sharing with you the basic tenet and the philosophy of what we're bringing to you today. And that is the knowledge that every person is born with the ability to heal themselves, and even the gift of healing others. This is a basic gift that all of us have. And so our job is to help you get into the driver's seat for your own health so that you can turn on these self-healing mechanisms. Anytime there's an outbreak, any kind of viral outbreak, it's always a reminder to us to maintain our immune system at optimal. We can definitely assume that most people will eventually be exposed to this virus. And that's why we're bringing you this today, because we feel that the most important thing is for you to empower yourself with the ability to really get through this in a transformative way that helps you internally and externally, and also helps you reduce fear around what's going on. With an optimal immune system, most people can handle a virus by developing immunity. Some may not even have symptoms, And in fact, we know that this viral illness can be contagious for 2 to 14 days before the person has symptoms. We also know that there have been reports that it's up to 27 days. So this is sort of the phase where it spreads through either directly, people who have the virus and are coughing and sneezing, or through the air, where it can remain airborne for hours, or through blood and feces, which do carry the virus. It's unclear whether they can spread the virus or not. So therefore, most of us right now are healthy, silent spreaders or shedders, if you will. And this is an important concept because if this is what we believe, that most of us have somehow been exposed to this virus, this is where the flattening of the curve comes into play, because what we're trying to do is reduce the speed at which people get this virus and reduce the collapse of the medical system, because you can spread it out. What do we know about reducing the viral spread? So we definitely know that the most important connector to our body is our hands. So our hands is what carries things onto us. And if you think about all the things we touch with our hands, and it turns out that the virus can actually remain active on these surfaces up to 9 days. So can you really stop touching these surfaces? And then can you stop touching your face? A study showed that medical students touch their face about 23 times an hour. So that's a lot. So becoming aware of that is hard. It therefore makes hand washing with soap and water the absolute best way to prevent transmission. And as a reminder, according to the CDC, the key times to wash our hands are after blowing our nose, coughing or sneezing, after using the restroom, before eating or preparing food, any type of contact with animals and pets, and of course, before and after taking care of anybody that we're taking care of, including a child. But do we wash our hands for 15 seconds or more? It turns out that's what's needed in order to reduce the load. And if you look at the WHO's website, you can actually see the proper mechanism. I remember when I was scrubbing for surgery, we used to be scrubbing our hands up and down both sides, and it makes this 15-second wash seem really simple. So that's something to pay attention to. Also, wipe down the surfaces. And we know that coronavirus is specifically inactivated within 1 minute by surface disinfection procedures if you use 70% isopropyl alcohol, 0.5% of hydrogen peroxide, the normal bottle is 3%, and of course, my least favorite, which is diluted bleach. And you dilute 1/2 cup of bleach into a gallon of water. Less effective are other agents. And if you look on CDC's site, you can actually see all the agents that are effective. I've been asked many times, well, can I use vinegar? Can I use oils? None of those are listed. We don't know if those are active or not. They probably are, but I like to stick to the ones that are actually proven to be active. So in summary, the basic common sense things that we need to do are wash our hands, reduce the touching of our face with our hands, reduce touching surfaces, and clean the surfaces 3 times daily, even in your homes. And I love this because these are some great alternatives to handshakes. Namaste is a very good one. The hand on the heart, I love that. And also we have learned to reduce the traffic to our home and office. If people are visiting our home and office unexpectedly, then we provide a mask and gloves at the door. This seems to be happening less and less though. If it's planned, we're asking them if they have symptoms, and if so, they should not come in or visit. And frankly, at this point, because we know that you might not have symptoms for quite some time, it doesn't make sense to even have unexpected people walking through your door. Keep a spray bottle on counters and doors. And for fresh produce deliveries and mail, you spray with diluted hydrogen peroxide. That's what we're doing. And diluted because you don't need a 3% solution. And so you only need a 0.5%. We're diluting ours half and half. And then, of course, we know social distancing is effective. And I mentioned that it's effective if it's early, because if you isolate cases early and you keep them separate, then you have less chance of infecting people who are susceptible, like the elderly and the people who have low immune response. At the point where we are actually probably most of us are already exposed to the virus. It would be nice to know whether we have antigens and antibody, because if we have antibodies, then we're not infectious to people as long as our antigens are negative. So once testing is widely available, this may be useful. So of course, all of us have reduced going to public places, events, work, travel, air, and school. And does that mean that we have to be bored? The most important thing to realize is that this is a transformative event in human history, certainly in our lifetimes. And the purpose that we're all finding is that it's a chance for us to reconnect to ourselves and truly become oriented towards the family and shift our attention to other things. And this is Dr. Gloria, who has taken to walking in the woods to decrease stress and boost her vitamin D. And then Christelle Renta, our nurse practitioner, who's grounding and laughing and playing, doing things that she might not normally do. And I say get outdoors, get naked and plant a garden, because honestly, all of us should be knowing how to plant a garden and grow our food. And we have a little project going on in our backyard as I speak. So social distancing does not need to be boring. It's a chance for us to sing louder in the shower and dance by ourselves and really get some inner reflection and connection to the divine. So assume that everyone needs to rebuild and maintain optimal immunity. And that immunity mostly lies in the intestinal tract or the gut. This is really important. So what we're about to do is learn about how to optimize the immune system, how to reduce the viral load, how to decrease inflammation or a cytokine storm, and how to rebuild the immune system in 30 days, which is going to come in the next presentation. Sejun's immune protocol history. Using our immune regimens, we're confident that we're protected and protecting others. Patients on these regimens say that they really work. So what do we do to start optimizing the immune system? So you remember that in the beginning, I talked to you about the 5-point model and the fact that what we've realized is that if you optimize each one of these areas, the body turns on self-healing. And over the last 15 years, we've had thousands of patients reverse any condition, including optimizing their immune system by doing this. The number one area is to optimize the adrenal thyroid hormone pathway, which is mostly a pathway that becomes suppressed when we're in a chronic stress response, which is what we're in right now, some of us. Chronic stress response does not mean we have chronic stress. It just means that we're having a stress response. So it doesn't have to do with how many hurricanes you have, but what response you have to them. The second area is nutrition. And what we're looking for in every bubble is optimizing to greater than the 75th percentile. So you may measure these things and be in a normal range, but really, are you in an optimal range, which is above the 75th percentile? And that's the kind of thing that you want to eventually look at. The third area is detoxification, which is critically important for the immune system, just like the hormones and the nutrients. And detoxification is mostly dependent upon how much water we're flushing our body with. That's how simple it is. And then, of course, we have the physical body stress, which is caused by lack of enough oxygen in our microcirculation and what I call heart-mind stress. Reason being that stressors can only affect our immune system if we convert them by having an emotional response that's negative. So that is how we control the response and the effect on the immune system. What we've learned over the years is that the imbalances in these 5 areas lead to all symptoms and disease, including immune weakness. And if you look at the long-living cultures, it's really cool to realize that long-living cultures actually correct this 5-point model because they're connected to nature. They're connected to the sun and to the earth by earthing into the ground and connecting to very rich mineral soil. And detoxification, which is basically, as I was saying, drinking a certain amount of water with pink salt and lemon to keep our pH up. And then, of course, breathing deeply, and most importantly, coming from a place and a vibration of joy, because what we know is that the body really doesn't want to function and stick around unless we're in a place of joy. So I want you to look at it this way, this model. If you think about the fact that physical and mental stressors fire your nervous system and make you use your fuel tank, which is the hormones and the nutrients, it becomes clear that the speed of the engine determines the use of the fuel tank. So the more activities we're doing, and maybe some that are not even important, the more we're using up our fuel tank, which is critical to prevent us from getting diseases, and especially which is critical to optimize our immune system at this time. So one of the exercises that we recommend everybody do is to simplify life and to go through this cute little exercise and decide what are your priorities. And I've definitely found over these last couple of weeks of staying home that the priorities become really clear. And everybody has their own, but there's no confusion about what the priorities are when you're sitting and doing an exercise like this. And also when we're doing an exercise like we're all being forced to do, staying in our homes. So what about the internal stressors, the subconscious stressors, the emotional response? So there, we must focus on the way in which we respond to stress. We may not be able to control how many hurricanes come our way or how many coronavirus episodes come our way, but we certainly can change the way in which we respond. And what do I mean by that? So there's been decades of research that has been done by the HeartMath Institute showing that the heart rate variability is truly the vibration that impacts our body. And the top tracing is a response that is one of fear or anxiety or worry. And the bottom one is a coherent positive one, which promotes immunity. And these are very strong measures of what is happening in our immune system, because this nervous system pathway happens to translate directly into the intestines, because 70% of the nervous system lies in the gut. Many of you may have heard of the term irritable bowel syndrome, which is not an intestinal issue, it's a nervous system issue. And that becomes really important because 70% of the immune system lies in the gut. So what do you think is happening when we're in a state of fear? What happens is the vibration of fear depresses the immune system. And I can tell you that that's one of the things that is happening here. In this kind of scenario, having fear as a predominant emotion is definitely a good depressant to the immune system. So how do you convert that? You convert that by having the knowledge, taking your power, getting into the driver's seat, and figuring out how you're going to lead your life and what you're going to do with it right now, which is different from the way it used to be. So I want to lead you just for 1 minute through this exercise that is a HeartMath meditation focused on your heart and converting your heart rate variability. So if you could each just close your eyes for a second and look at this beautiful space and imagine yourself in this field of flowers, and breathe slowly and carefully in and out of your heart, in and out of your heart. Deep breaths. And I want you to create a virtual reality. What does it look like? What are the colors in the air? Keep breathing. What are the sounds you're hearing? Is the breeze blowing? What are the smells? Are you getting the aroma of the beautiful flowers and the taste of fresh air? The taste of fresh air. The smell, the taste, the sound, the look. Immerse yourself in that spot and stay there, because as you do that, your heart rate variability goes to the blue line and you're able to replenish and promote your immune system. So let's move on. So the daily routine for your home is going to include getting in the sunrise for 30 minutes. Very important, naked if you can. Eating real food, which is organic. Using supplements as needed. And there's a measurement method that you can use to figure out what you really need. And grounding yourself into the earth. We were given all these things, nature gave them to us. There's nothing much you have to do to have access to the sunrise and the earth. Prepare 100 ounces of water with pink salt and lemon. Most importantly, reduce your electromagnetic field radiation, because electromagnetic fields do disrupt the bacteria in the intestines, which is your microbiome, which means your immune system won't work quite as well. Make sure that you have conscious breathing every hour. Just breathe. We don't breathe. Get outdoors, breathe some oxygen, and most importantly, simplify your life and use heart math tools, because the vibration of joy is going to promote immunity as opposed to the vibration of fear. And with that, I want to start sharing the regimens that will help to reduce the silent spreading and also to reduce progression and intensity of this virus. The basic immune protocol that we have is a daily routine, and it's for people who have no symptoms because it prevents the onset. It includes highly bioactive silver, a probiotic, multivitamin mineral, and vitamin D. I'd like to go through briefly the science of each one. And at this point, I would like to shift to introduce Dr. John Apsley. Do you think you could introduce yourself? I'm going to move this camera over. And you're kind of in the center of it. There you go. Okay.
Hi, everyone. Again, this is Dr. John Apsley. I'm today 8 years older than Dr. Patty. So
yeah, it's your birthday.
I'm going to need to refer to some notes here, because my experience with this goes back almost 20 years. And I want to make sure I don't leave anyone out who's played a major role in helping me to become one of the foremost experts in the field of using silver nanoparticles in clinical medicine. So for 20 years, I've been using this, and I also have taught this to health professions across the globe. And I've also had the privilege of researching it as one of the most amazing immune intervention agents of all time. In late 2001, I started working with bioactive silver nanoparticles and also see it directly under TEM, transmission electron microscopy. I was able to observe it in comparison to other emerging silver nanotechnologies. And some of the pictures you'll be seeing here are just absolutely fantastic to illustrate what an amazing product this is. I, along with Dr. Eric Renz, who you will see presented one of the first papers in peer review on the subject of silver nanoparticles in SARS-1, were the first two physicians blessed with working with this amazing substance back in late 2001 and early 2002. From 2006 to 2008, I served as the executive director of Immunogenic Research Foundation, and we were charged to conduct scientific research and to provide medical education to the world at large, which we did. And at that time, I also was fortunate enough to acquire perhaps the world's largest library on silver in medicine. The foundation's board members included Deborah C. Mash, PhD, professor of neurology and molecular and cellular pharmacology at the University of Miami School of Medicine, as well as Brian Clement, PhD, NMD, director of the Hippocrates Health Institute. Our medical advisory board members were stellar. They included Drs. Virginia G. Osborne, amazing naturopathic physician. She was the attending physician at National College of Naturopathic Medicine, it was named at that time, and supervised our first clinical study with HIV and had some amazing results there with the product. Also, Jonathan Wright served on our medical advisory board. Dr. Dana Flavin, MD, MS, who was formerly with the FDA's toxicology department. She now practices in Germany. Deborah A. Metzger, MD, PhD, and Steve Hines, naturopath, as well as many other integrative physicians from around the country that are top-notch. While serving as executive director, I was able to lecture starting in September of 2006 at the 5th China International Silver Conference in Panyu, China. I presented a lecture entitled Nanotechnology Discovers Universal Pathogen Solution, where we presented evidence-based research on the treatment of SARS-1. In November of 2006, I presented to the Biophysics Division at Boston Scientific, covering bioactive silver's regenerative role in enhancing human epigenetic signaling. In June of 2007, at the LIA Foundation's first annual Lyme Autism Conference, I was fortunate to present a presentation entitled Fundamental Causations to Autism, Mercury, Intoxication, and Lyme Disease. There is a strong connection there. It discussed how to do immunorehabilitation with silver nanoparticles, and also how to manage the infrequent Jarisch-Herxheimer events that do occur when the body's being eliminated of its chronic infections with the silver nanoparticles. In late 2007, at the first Paris Symposium on Overcoming Advanced Cancer, I presented a lecture on the roles that nanoparticle silver can play with eradicating infections from those cancers that have an infectious etiology. I am the author of 7 books, including a fully referenced 3-volume treatise on bioactive silver particles, nanoparticles. And I will also serve as editor and co-author of over 20 fully referenced white papers on the subject. Therefore, I consider myself to be one of the world's top experts in this field. I hope that I can share with you at least a great deal of what I know in the short lecture here, so that you too can be empowered to safely traverse this difficult time that we're having.
There you go.
Okay, so we're not moving. Got stuck with that long expose. There we go. So the history of silver and its use in medicine goes back for thousands of years. The Greeks and the Romans used it to preserve drinking water in their armies that marched about to feed the troops healthy water. Hippocrates was the first to describe its antimicrobial effects. And I found this quote, it's absolutely amazing. It goes back to antiquity. Silver's anti-infectious properties and wound healing are renowned. They go back to battlefield medicine into the 1800s in the modern era. So for faster healing, we know that one of the first silver salts was used to treat wounds and skin ulcers. It stings like heck when you use it though. And it was also used to treat syphilis back during the Civil War, and is even used today to treat the eyes of the newborn to prevent chlamydia infection from causing blindness. So what is bioactive silver? There are several different groups or speciations. Silver salts I just mentioned, it has very low bioactivity. You have to use a lot to get an effect. Homemade colloidal silver, it's not good stuff. They're very large particles that spark and sputter off of the electrodes from the silver electrode that's in the water. And if you drink a lot of it over a long period of time, it has been known to cause argyria or discoloration of the skin, and it's not reversible. Bioactive silver, or silver ions in water that's over 98% positively charged, is the most active. And there are emerging, in the research field, there are emerging AGNP products that are coming up that we'll be seeing a lot of reference to here in the next few slides. But NASA was the first to really do research to try to keep the water recycling mechanisms inside the tight space capsules from reinfecting the astronauts from one from the other. And they found that very, very low doses of silver were able to completely kill viruses as far down as 50 parts per billion. So it's an amazing substance. So in the sub-nanometer range, we're talking about below 1 nanometer size particles is extremely powerful. That's why we're referring to that kind of range of silver particles as being the most bioactive. They start about 300 nanometers. They're not used too much now any longer in research. That usually starts about 100 nanometers down to 50 nanometers and even lower. Keep in mind that 1 micron is 1,000 nanometers. So we're way, way, way down below what you normally would make at home with a colloidal silver manufacturing device. They're just not as good as what is now available. If you take a look at the pictures here, you can see the difference what I'm talking about. So at the very top end, you see particles at 1 nanometer or smaller, all the way down to 0.7. You can see that they're uniform because they're all positively charged. They push away from each other. That's why they're dispersed like they are. And that causes their surface area to become huge. And their particle diffusion coefficient means they can pass through any biological membrane, any virus. They just pass right on through it and just start whacking the heck out of it. We'll talk about that in a second. But below that uppermost photograph is what I call junk silver products. These are silver products that are sometimes called colloidal silver, and they could be homemade or they could be made by various companies. And you can see how it's all kind of stuck together. And the parts that are in the center of these large black areas are not usable. They're not exposed, so they can't make contact with anything. So here's what a bacteria looks like. And when silver nanoparticles hit it, it starts hitting and tearing apart different aspects of that bacteria very quickly. The cell wall, for example, the internal respiration systems or metabolism of the bacteria, most of the metabolic pathways that have to do with enzymes, which are protein-based, and then the replication ability, which is gene controlled, which has a lot of protein structures in them. So it just tears those protein structures apart. With viruses, it's pretty much the same thing. Its interaction with the virus surface, it just rips it apart. If you look on the picture, you'll see some red dots. Those are the silver nanoparticles. This comes from recent peer review. And so you have the silver attacking the virus before it hits the host cell that it's invading, so it can make more of itself. It's important to realize that viruses are not alive, so they don't have antioxidant protection. So it's really easy for the silver in this particle size range to easily penetrate it and start tearing it up. But as that virus starts hitting the membrane of the host cell that it's invading so that more of it can be made, the silver can be right there also just tearing apart. As it goes into the cell, these silver nanoparticles are able to enter into the bacteria, into the host cell as well, and destroy the virus inside the cell. That's well documented now. So if the host cell has been taken over by the virus, it's no longer a healthy cell and it needs to be eliminated. And this is another aspect that the silver can do some intervention with and help cancel that cell's ability, that host cell, that host human cell, to manufacture viruses that are going to work against you. And then as the virus goes through its different replication aspects with DNA and RNA that have protein structures that help them, the silver is going to tear those apart as well, and on its way out as well. So SARS is composed of, just like what most viruses are composed of in terms of overall molecular components, they're very proteinaceous based. And these are all great targets for silver to rip apart. So here's a picture of the SARS virus in a very uncomplicated way. And what silver is going to target are, again, the protein-based aspects of this virus, including the inflammasomes, which are enzyme-based. They're a part of the autophagy system of the host cell, which we're going to talk about in a future seminar. There's a lot of different combination drugs now are being used to go after that, to stop the virus from replicating, and it does work. Other aspects called furins, viroporins, nucleocapsid proteins, protein genes, protein kinases, and RNA polymerases. Those are enzymes that are protein-based, as well as other aspects of the virus that are very common, not just to SARS, but to many other viruses. So these are the targets for silver nanoparticles that is small enough and bioactive enough just to rip those structures apart. Okay, so we can know now and can say this for sure that AGNPs, bioactive silver nanoparticles, just tears apart all kinds of viruses, including the structures, molecular structures that are found in coronavirus as well as SARS. We have enough research now to know that. There's Dr. Rentz's article that was the first published article in the world in a peer review on the subject back in 2003. You can see it's been updated since then. So here are the viruses that are known to be successfully clinically treated, as well as in the in vitro university studies that are studying these AGNP particles to go after different viruses. And if you notice the viruses in blue, these are the ones that attack the upper respiratory system. So you can see that AGNPs do a great job. If you look down not only at the coronavirus, SARS, and the MERS is a form of coronavirus. If you look down at the last one, which is RSV, that's also a very well-studied upper respiratory tract infection of both animals and humans. And silver nanoparticles will tear it apart. These are the references. I want to make sure that there's no doubt that there's a huge body of science on this. Remember, I said I collected one of the world's largest libraries on the subject, but today there's got to be well over 200 references on it just in the past 10 years. But this is historical accounts that go back 50 years or so and up to the recent last few years. Currently, there are thousands of physicians all across the globe using bioactive silver for their patients. And that's been the case for well over a decade. So it's been mostly not in the public's eye. It's been something that hasn't been spoken about very much in out in the open until now. So I hope that you recommend as many folks as you can to view this webinar, because it will be recorded for sometime in the future. So what the silver actually does is like a butcher's cleaver in a sense. It produces a radical oxygen species, and because it's vibrating so fast, and it shares its energy, and those electrons spin off and attack, join in with oxygen and cause a radical oxygen species. And it's like hydrogen peroxide pouring onto an open wound. It just rips into anything that needs to be disinfected. And human tissues have protection against silver, antioxidant protection. So it doesn't hurt higher life forms. It only hurts lower life forms as long as the individual has been properly nourished and they have enough antioxidant protection there. So this is really important about safety. These are the references here that are most up to date. It's very easy now to control the dose of silver, especially in the nanoparticle size, so that it's only lethal to silver, to viruses and infections, as opposed to human tissues. You just have to dose properly. The no observed adverse event level is the best standard for silver safety that's used both in medicine as well as for any kind of food-based preservatives. And we know from the latest research that the null for AGNPs, the bioactive silver particle nanoparticles that we're talking about, is extraordinary in terms of safety. You can take 3,000 teaspoons of 25 part per million or smaller bioactive silver nanoparticles and be well within the safety limits. So it's this kind of product, these kinds of products are extremely safe. And this is over, the studies were done over 90 days. And what you do when there have been also human studies, but with animal studies, there's a conversion. It's called the HED, and it's standard. And it's able to calculate from the animal to the human being what the equivalent dose is. And that's what you're seeing here for the 3,000 teaspoons of 25 parts per million or less bioactive silver. Okay, so we just established that it's perfectly safe. If you take it 6 times a day, a teaspoon that is, you can take it 76,000 times without exceeding the oral silver reference dose that the EPA has established. So again, if you're allergic to silver, if you have an autoimmune disease, if you're taking blood thinners, if you're undergoing chemotherapy, or if you're under 5 years of age, you really need to get with your doctor and be supervised or not take it. Also, if you're pregnant or nursing. And again, if you're worried about turning blue, compare the 2 photographs. The upper photograph has that safety margin that we just went over, whereas the photograph below, which is very common today on the commercial market across the globe, it ain't where you want to go. You want to stay with the top-notch, commercially available food-grade AGMPs. So in our professional opinions, the immune system and how it works largely relates to how well we feel. And highly bioactive silver nanoclusters form quite possibly, in our opinion, the most powerful immune optimizing food supplement that's ever been developed and maybe that ever will be. The basic immune protocol, just for extra protection right now, is 30 sprays or 1 teaspoon. They are the same. Under the tongue twice a day on an empty stomach. Silver is very active at this particle size range. So if you don't take it on an empty stomach, it mixes with the food and it loses a lot of its efficacy. So take it on an empty stomach. If you take it 15 minutes before you eat, it's fine. And you need to wait about 3 hours after you eat before it's starting to take it again. So, you know, if something should happen and somebody should cough on you or be nearby and sneeze, don't panic. Just distance yourself from the situation, wash your hands, and you can pump 2 sprays of the bioactive silver nanoclusters. There are different products out there. There's only one that I know of that's professional grade. But this is a good way to protect yourself. And you can also do 5 sprays, which is way less than a teaspoon in the mouth, just kind of get the mucous membranes, clean them out. When traveling into public spaces, especially when you're doing air travel, I would suggest you carry the gel with you and you can use it on your hands. You can also spray it. And if you're in a tight area where people are coughing, that air is recirculated. And we now know that the coronavirus can stay in the air for 6 hours. So if you want to do 1 spray or 2 sprays up each nostril every 20 minutes, 30 minutes, it's a wise thing to do and it won't hurt you. Or you could just wear an N95 face mask, which is a great alternative. But always wash your hands, because if you scratch your eye, it can go in through your eyes. Now, the children's dosing of these is half of what the adult is if the child's age is between 5 and 12. Children that are 13 and older have gone through puberty, they take the standard adult dose. Our patients tell us that when they do this, they just feel so much better, and they have very few days that they're on sick leave, if any at all. The 4 basic things to our program, as we mentioned earlier, is the bioactive silver nanoclusters. It's a multivitamin supplement, mineral supplement, particularly has selenium in there, zinc, copper, iron. Those are important things for the immune system. Vitamin D3, very important, but also the probiotics. So probiotics control the human microbiome and the gene pool by about 70%. of the gene expression. So it's really important you get probiotics. Okay, so I'm going to turn it back over to Dr. Patty, and she's going to finish up. Thank you.
All right. Well, that was really informative. I think it's unbelievable how much data is actually sitting there around this bioactive silver. And I'm so, so happy that we have it. So really, the microbiome is a word that all of you have heard more and more. And we know that actually more than half of your body is not human. It's the bugs. And it turns out that last month, they published a study showing that the lactobacillus and the bifidobacterium are actually decreased in COVID-19 patients. This is very important because this is where the probiotics come in. And the most important thing is to start by protecting the microbiome. And what do I mean by protecting it? What I mean is watch the things you eat, make sure that you're not eating processed foods and you're eating real foods, and also to be aware of how much Wi-Fi and electromagnetic radiation you're getting from your cell phones, your 5G, and your basic Wi-Fi in the home. I usually tell people, when you're not using the Wi-Fi, turn it off because it destroys the microbiome of the gut. So it turns out that probiotic supplements or food end up being the #1 immune staple supplement that we use. And you want to make sure that you have both lactobacillus and bifidobacterium in variety of species. Probiotic coconut milk yogurt that is therapeutic, that also has a list of species that are similar to different bifidobacteriums and different lactobacillus. And of course, fermented foods. And you may know that in ancient cultures, and I know in our culture, fermented food was actually a very important part of the daily routine. And over the years and decades, this fermented food has gone away. But I would tell you that you should look into fermented food and look into how to maybe bottle the fresh things that you have in the form of fermentation, because it has more enzymes, it has better probiotics, it's safe because the lactic acid kills E. coli, its preservation mechanism is much better than canned, and its nutrition is more bioavailable than regular food. And I think if you go and dig back to all your cultures, you'll see that somewhere in there was fermented food. Remember, living probiotics should be taken separately from bioactive silver, which means that 15 minutes before the meal, you take the silver. And then at the end of the meal, you take your probiotic or your active fermented food. What about the next one? Multivitamin mineral. So it turns out that all of these vitamins, A, B, C, D, folic acid, zinc, copper, selenium, all of them are critical parts of the immune system. And of course, the most important place that you should be getting these things from is the food, because nature has packaged these things in the food in a much more bioavailable form. Since we know that our soil is 60% below where it was 50 years ago, according to the USDA, we end up in a situation where we do need to supplement. And what we need to look for is vegetable capsules with no dyes, no preservatives, no magnesium stearate, and no fillers. And we're also specifically looking for minimally biologically active doses of all of these different minerals and vitamins. And these are the ones that not only activate the hormones, the thyroid axis and the adrenal axis, but they're also critical components of your immune response. In order to find out what you really need, you should get micronutrient testing so that you can actually know whether you need to supplement or not. And that brings me to vitamin D. What studies are showing is that the higher the level of the vitamin D, the lower the risk of infection. And that was actually published in 2017. We also found that vitamin D actually increases the antiviral activity in bronchial cells, and that was published a few years ago also. Vitamin D supplementation protects against acute respiratory infection in the British Medical Journal. So it's obvious that we have the vitamin D in our regimen, and this is something which we've been using for decades, and people have absolutely reported the success in using it. So I recommend 5,000 to 10,000 units daily on the basic immune regimen, and to keep the vitamin D levels above 70. So the basic immune protocol has probiotics, greater than 30 billion diverse species, essential multivitamins and minerals, vitamin D, and bioactive silver. What's next? So what's next is the advanced immune protocols for early symptoms. And we have 2 dosings that go up in this phase, which is both the bioactive silver and the vitamin D, which we're going to cover right away. And of course, to reduce the chance of a cytokine storm in the lungs and the kidneys, because this is the part that actually is the most dangerous part of this virus. So as far as symptoms, this was published early on from the Wuhan district in China, where they published the top 5 symptoms being fever, dry cough, fatigue, sputum production, and shortness of breath. And then there's a host of other things that you see on the right side of this slide. And note that there are people who present with only gastrointestinal symptoms, and that can be up to 10% of people. So what we believe is that with early viral symptoms, the objective is to reduce the bioactive, reduce the viral load with bioactive silver. And at this point, I want to turn it over to Dr. Paxton so that we can hear about that dosing.
Okay, so 2 quick stories, and then we can get into the specifics. So my son, John, came down with whooping cough, pertussis, when he was about 2.5 years of age. He had spiking fever of over 103.5, which is a medical emergency. And I was lucky enough to be able to get him 1 teaspoon of bioactive silver nanoparticles into him every 20 minutes, because it basically tastes like water. Within 4 hours, the fever had completely broken. It already started to break about after the first 3 or 4 doses. And after 4 days, no more croupy cough at all. The second case is at the National College of Naturopathic Medicine. Dr. Virginia Osborne and I were supervising an HIV case. And we noticed that the viral particle drop was amazing with the treatments that were rendered there at the clinic. It works. And so if you're an adult, you want to take it every 20 minutes or so when you're first talking about feeling some of these symptoms, and always on an empty stomach. And then as soon as the symptoms begin easing, reduce it down to once every 30 minutes, a teaspoon. And then as they continue to ease, you can reduce it down to 1 teaspoon every 60 minutes, but stay on it for about 10 days total. And that's about the time that your immune system can kick in and develop what everyone's talking about today, which is you can become part of the herd that's developing immunity to this thing. Okay, did that just? All right, so that was good. So you can always just follow the directions from your doctor. With children that are 5 and above, they're going to take half the dose that we just listed out there for the advanced protocol. So Dr. Rentz was the first to publish on this back in 2003 in the peer review. And he mentioned, as it was in the case of my son, for example, we had access to a nebulizer and didn't use it much, but we used it just a little bit. He was a little fussy, so he mostly took teaspoons, which he didn't fuss with. And it's amazing. Coughs can almost instantly stop that urge, that itchiness with nebulized silver. So we've checked the literature out pretty thoroughly and to know what the safe levels are for the lungs. And the current literature is pretty strong on this. At less than about equal to 25 parts per million of bioactive silver nanoparticles, but under a doctor's supervision. you're going to see that it is safe to handle up to 600 micrograms per month, which translates into 20 nebulizer sessions total. And you'll be using a 1/4 teaspoon up to 4 times daily, or you can also increase it to 1/2 teaspoon 4 times daily, but only for 2 days. And then you can cut it back for the final 3rd day. So those are 2 different ways to take it. And under a doctor's supervision, your doctor can tell you which is best for you. So for children 5 to 12, it would be half that dose. And again, under your doctor's supervision, a maximum of 10 nebulizer treatments. And because it's half dose, it's 300 micrograms over the course of a month. And again, it's just half the dose that we just were talking about. For children that are under 5, you got to get with your doctor. I did it with my son because I was so familiar with the properties. But it's really, really important that you're working with a doctor for the very young. So at any rate, this gives you a really great idea about what can be done with doctors that are experienced with this. I do want to mention that a multi-daily vitamin mineral supplement that contains selenium or the amino acid NAC are absolutely fantastic for increasing the range of safety of any silver product. This is the advantage that I explained earlier, that viruses don't have internal antioxidant systems to protect themselves from silver, but humans do. And NAC and selenium are hugely important for us to make enough of those internal glutathione systems. The references here that cover what we just discussed are very recent. And I'm going to turn it back over to Dr. Patty now for the vitamin D.
This is pretty interesting, this sharing camera routine. Okay, so this is a routine that we've been using for quite some time, and it is a high dose taper, which is meant for adults. Day 1, and this is day 1 of symptoms, you take 50,000 international units. Day 2, 40,000. Day 3, 30,000. Day 2, 20,000. And day 5, 10,000. If you recall, in the basic regimen, I had suggested that you use 10,000 units a day, or 5 to 10 to maintain your level above 70,000. And it turns out that vitamin D, and to keep the serum level above 70. And we know that vitamin D does activate the antiviral properties of the bronchial cells. So in the advanced protocols, we've got the high dose vitamin D taper, we've got the bioactive silver at a higher dose, and our next is how do we protect from a cytokine storm. So we know that this virus initially loves lung tissue and then goes to kidney. And then it seems that it's very possible that it actually goes to all of the organs. So you really have to be prepared to support lung functions. And this is anyone and everyone who starts to have early symptoms. And the reason is because the most dangerous part of the coronavirus is in its later stages when an inflammatory storm forms in the lungs and the kidney. And it's really caused by an uncontrolled immune response that leads to acute respiratory distress syndrome, which we'll be covering next month, necrosis, tissue destruction, and of course, death. So this is something which we really don't want. What we're looking to do is to try to reduce these things so that you stay out of the hospital. And that's the purpose of empowering you with these kind of protocols so that you're in the driver's seat here. So the preventative anti-inflammation turns out to be absolutely critical for the lung. And so starting with the fact that anti-inflammatory foods should be a staple part of your thinking process for food. And you see a beautiful picture of curcumin there. My mother has always taught me about the properties of curcumin, and she has me chasing around herbs in our garden that are potentially effective on this virus. So this is ancient knowledge, but of course we know that these are anti-inflammatory foods. Our top anti-inflammatory nutrients for lung support include, obviously, omega-3 fish oil. And we're recommending 6 grams per day. because it has powerful anti-inflammatory effects because it neutralizes inflammatory cytokines, which cause the destruction in the organ tissue.
I
And
need to say one thing here, sorry. If the oil is not highly digestible, it can cause problems. So when you take your fish, this just came out. If the fish oil is in a really good enteric kind of coating to ease digestion ability, 6 grams a day of it is wonderful. But they just did this study. I didn't have a chance to tell Dr. Patty about this. It can aggravate if the oil is going through the intestines too fast. So just so you know that.
yeah, so you want to use an enteric coating for sure. That's really important. But these are the ones that the study shows that it neutralizes. And we also have a published study now just done in 2019 showing that high-dose omega-3 fish oils can expedite recovery in critically ill patients who are in the ICU on ventilation. So this is really important that this is a critical part of the lung piece. And I suggest everybody get on it if they have any kind of symptoms. The second is N-acetylcysteine. And this is a study that shows that it doubles the recovery of pneumonia patients on a ventilator. This was published a couple of years ago. And they had a real increase in patients who recovered when they used the N-acetylcysteine. We recommend 600 to 900 milligrams with meals. Most people notice rather quickly that they can breathe a lot easier when they start to take this because it breaks down the mucus. You don't use N-acetylcysteine if you're sensitive to sulfur. It's very safe, but rarely people can develop rash or diarrhea. So you stop immediately if you get those symptoms. And you see a picture of food up there because I have to say that food always comes first. But when we're dealing with these kind of things, you need a certain dose. So do take the fresh foods and also use the N-acetylcysteine. The pharmaceutical alternative to this would be to use hydrocortisone 5 milligrams 4 times daily with food or low dose Medrol pack, because correcting the inflammation in this phase is important. These are not things that you do in the early phase. The third is zeolite or clinoptilite, which works like metal nanoparticles, like bioactive silver. It works with it. So when these two things are together, it increases the antibacterial effect specifically in the lungs by manyfold. And the fourth is melatonin. And what we know about melatonin is that it's a powerful antioxidant which can prevent multi-organ failure in sepsis. That was published just this year and actually in a hospital setting. So I think that melatonin is also a really important one. And we're recommending to go over it, the anti-inflammatory regimen, which is part of the advanced immune regimen, omega-3, 3 to 6 grams per day, N-acetylcysteine, 600 to 900 milligrams with meals, melatonin, 9 milligrams with meals, and zeolite, 30 drops twice a day with bioactive silver. So that's the anti-inflammatory regimen. These statements have not been evaluated by the Food and Drug Administration, and these products are not intended to diagnose, treat, cure, or prevent any disease. So what I have recommended is the program that we're using at Sejun, a daily immune routine for your home, which includes, remember, get in the sunrise, get out there 30 minutes a day, try to eat real food, grow your food, supplement as needed, ground yourself into the earth, prepare your water with pink salt and lemon, which raises the pH and allows you to flush your body, which is 70% water. Reduce the electromagnetic field. Breathe consciously. Oxygen comprises 68% of the elements in the human body. So obviously it's a very important part of correcting this. And most importantly is to re-examine our modern life. I always say that, modern civilization could really be man's greatest disease. And we're being forced to dial back and connect ourselves into nature, into the trees, take the moment to dance by ourselves, sing by ourselves, plant a garden, play games and connect to the family. I myself love drawing, so I love watching this guy, Bob Ross, teach people how to draw. And I'm sure this is one of my big activities that's going to be happening. Who knows? The next Picasso may be coming up soon. And of course, cooking. And sometimes I have to call my mother and ask her about new recipes because I get bored with my own. Let's look at the lovely transformative things that are happening around the earth related to us reducing our human activity. The fish and dolphins have returned to the canals of Venice, and the air over China has cleared up. And this is a recent picture of the air in New Delhi, which you could never see this blue sky. So this blue sky is something that has happened after the reduction of traffic. My feeling is that during this time, we will be voyaging deeper into ourselves, and we will feel the sun on our wings as we become more powerful and become in the driver's seat for our own health and our own destiny. So I hope this gives you some peace of heart and mind. And we thank you very much for your attendance today on Saturday afternoon. God bless you.